If you're not using choline, I'm going to help you understand some amazing benefits that can come from supplementing with choline. But if you are supplementing with choline, you also need to understand when it's really important that you stop or at least reduce your dose. I think this is going to freak you out a little bit.
TC Hale is not a doctor and does not claim to be a doctor or licensed in any type of medical field. Don't be an idiot and use anything heard on the show as medical advice. This information should be used for educational purposes only, and you should contact your doctor for any medical advice. Now get off me.
So choline is a vitamin-like substance that used to be classified as a B vitamin, and now it's not. I don't know, maybe the B vitamins are like, you don't even have B in your name. You don't belong in here. That's probably how science works. But in any case, it appears that we have the ability to make choline in the body. It just isn't enough to kind of get all the functions working the way that it should in the human body. So we need to bring some in from the foods that we're eating. And you can get choline in food sources like eggs and beef liver and even some cruciferous vegetables and other sources. But it appears that we really need to bring it into the system. And it's very important. It's a building block for acetylcholine, which is like a neurotransmitter that helps us send signals from the brain to the body and help all those things function. There's a lot of studies, and I'll put some links in the description below, kind of indicating that using choline can be a big time cognitive enhancer, and it can kind of help keep away those age-related memory decline issues. And it can also be very beneficial in issues like non-alcoholic fatty liver and in preventing cholestasis. And this is one of the things that we really like to use choline for, is to make sure that that bile is not becoming so thick and sticky that it can't flow correctly. And if you haven't heard me talk about this in the 737 other videos that I've talked about bile flow, the liver makes this soapy substance called bile, and then it stores that in the gallbladder. And then the gallbladder squirts this bile down into this duodenum here after our food is acidified and comes down here. And that really helps us break that food down and get all the nutrients out of that food. That bile also helps us access fat-soluble vitamins like A, E, D, and K, and those are important for a lot of factors. And also the liver puts a lot of the toxins that it filters out of the body into that bile, so that when the bile comes down here, it carries those toxins through the intestinal tract and they go out the back door when we poop like a champion. So this bile is really important, not only to help us access all the nutrients in the food that we're eating, but also it's the main detox pathway to the whole body. So we use choline a lot when someone seems to be having trouble where their bile has become too thick and sticky to flow correctly, and they're not getting all the benefits of that bile flow. And when that bile is not flowing, it stays in the gallbladder, where the gallbladder's job is to concentrate that bile. And if it continues to concentrate it, because it's not leaving the gallbladder like it should, it can concentrate into sludge or even stones, and you don't want gallstones. It's not a good time. So this is one of the reasons that we use choline with a lot of our clients, is because it can be so beneficial in that area. But a lot of people now are using it for all of these issues, like, hey, I want to be able to remember what I did on Thursday, so I'm going to take some choline. And it seems to actually be beneficial in that area as well. And when you're considering, oh, should I be using choline, we need to think about a few things like needs. And there seems to be some polymorphisms, and I'll put a link to some papers below in the description. But these polymorphisms seem to cause problems with some people bringing in choline or utilizing it, and they might need to bring in a little bit more to get all of the benefits from choline. And we really need to look at our bio-individuality, because the fact is there is no supplement that's right for every person. There's no food that's right for every person. There's no diet that's right for every person, because we all process these things differently. So what we like to look at is an individual's breath rate. And the reason that we want to look at that is because when we're looking at the choline and the benefits it can bring, we also need to understand the trouble that it can create for some people. And for that, we need to understand the Bohr effect. And we all learned about the Bohr effect in the 8th grade, and then we just never talked about it again. I'll put a link in the description below if you want to dig deeper into this. But what it tells us is basically that we need to understand that the blood has this pH range that it has to stay within, or we just kind of die. And the body doesn't want that to happen, so it has a lot of mechanisms that it uses to kind of regulate the pH of that blood so that everything can work correctly. And what happens is when the blood's pH goes too far on this alkaline side, and it's a higher pH value, then what's called the Bohr effect kicks in. And what this says is when the pH is too high in that blood, that oxygen can't get down to the tissues where it needs to be. And we create these oxygen utilization issues. So we don't want this blood leaning too far on that alkaline side. And this usually has more to do with like CO2 levels in the system, and there's other things that can change the pH of the blood, but I don't want you to look at this like I'm one of these pH guru idiots that's telling you, oh, you got to alkalize or you're going to be dead by Tuesday. That's not what we're looking at when we're looking at this. There are people that could benefit from their blood being pushed a little bit more on that alkaline side, but we don't want you to alkalize the whole body like a lot of these people tell you to do. If you want to understand that better, we'll put a link in the description below for our video on the truth about pH balance, and you can understand that a little bit better. But if we look at our breath rate, we can get an idea of how much the body might be trying to compensate to try to balance out that pH a little bit. So what you can do is you can just set a timer for like a minute, just 60 seconds, and just relax and try to breathe normally and count the number of inhales that you take in that 60-second period. You don't want to count an inhale as 1 and an exhale as 2, just count the inhales. And if that breath rate is somewhere between 14 and 18, that's pretty ideal. That's what we like to see. Now, if it's going lower than that, then what that's telling us is that the body is slowing the rate at which we breathe in an effort to hold on to more CO2. CO2 is what comes out when we exhale, and CO2 is acidic. So if this bloodstream is leaning a little bit too far on this alkaline side, and it's creating all these oxygen utilization issues, then the body is like, hey, we kind of need oxygen and we kind of need to be able to use it properly. So I'm going to slow this rate at which we're breathing so I can hold on to more of this CO2, help to acidify that blood a little bit, and balance things out so the body can use oxygen correctly. So when this breath rate is going low like this, it's just an indication that the body's trying to correct some problems. This is not a diagnostic thing. You're just trying to get some ideas of what's going on. I'm not a doctor, and I'm not telling you to change what you're taking. If your doctor's like, hey, you got to take choline, don't listen to me, you listen to your doctor. But this kind of helps us understand that if the blood is leaning too alkaline, it's creating trouble. And what we need to understand about choline is that it appears to have the ability to push that blood a little bit further onto that alkaline side. So if the body's already problematic in that area and you take a bunch of choline, you could really magnify that problem. And you might see that your breath rate starts to go even lower the more choline that you use. And that doesn't mean that you might not need choline for other areas. They might be benefiting other areas. But if you're really supplementing with a lot of choline, you could be magnifying a problem that's already there. Now, if you're getting choline from food sources, it doesn't seem to be able to magnify this problem as much if someone was supplementing with choline. Now, if someone's breath rate was greater than 19, indicating that the blood might be leaning a little bit too far on that acidic side, and the body is increasing the rate at which it's breathing in an effort to huff off that CO2 and get rid of more of that CO2 to make that blood less acidic. In that scenario, then a person might want to increase the amount of choline that they're taking to help balance out that blood a little bit and make it a little bit less on the acidic side. So I'm not going to give you a dose of how much choline you should take. I'm not allowed to do that. You'll have to research that a little bit. But these can kind of give you some indications of, well, if my breath rate is lower than 12, then maybe I'm taking too much choline and I should back off a little bit. And if it's really high and my breath rate is 19, 20, or 21, then using some choline to help balance out that blood pH could actually bring about a lot of benefits for you. Now, like I said, we use choline a lot to help thin out the bile, to improve that bile flow, or if someone's breath rate is really high, because when their breath rate is really high, it seems to change the way that they're processing some foods. They might rip through fuel a little bit too quickly, and it seems to create some mental or emotional issues. So there's a lot of benefits that can come from supplementing with choline. But if you're seeing now that maybe this is not right for your bioindividuality, maybe it's causing problems and your breath rate is already too low, but you still want to take steps to improve your bile flow to make sure your body is detoxing correctly and that you're able to access fat-soluble vitamins and all the other benefits that come from bile flowing properly, you can jump over right now and check out our video on 5 steps to improve bile flow to learn other steps you can take to make sure that that's moving the right way. I can't wait to hear about your results.